1, 2, 3, 4, and 5. Okay.
I want you to imagine that you're a healthy 26-year-old, and then all of a sudden you get very, very sick. You lose a dramatic amount of weight, and then next thing you know, your arms and legs are tingly, and you're extremely thirsty. And then finally, your vision goes. You go to the doctor several times, and nobody can figure out what's wrong with you because you have no family history of anything. And then as a last resort, the doctor simply pricks your finger, and then you find out that your blood glucose is off the chart, and then tells you you have diabetes. According to the American Diabetes Association, 25.8 million children and adults have this disease in the United States. There are 3 types, and while there is no cure, if it's managed properly, you can live a long life with a low risk of complications. Diabetes is a disease commonly due to the inability of the body to use sugar. The simplest form of this disease is gestational diabetes, and it can only occur in pregnant women. The Center for Disease Control says it develops in only 2 to 10% of all pregnancies, but it disappears once the pregnancy is over. This is easily managed with diet and exercise. The most common form of the disease is type 2. Type 2 is when your body builds up a resistance to insulin. Insulin is a hormone needed to convert sugar and starches into energy. The most common causes of type 2 diabetes are age, weight, and diet. Diet and weight go hand in hand because if you eat poorly, you gain weight, you become overweight, and then you become higher risk for the disease. Typically, people over the age of 50 are higher risk because our bodies don't quite work like they used to. This disease is managed with medication, typically in the pill form, and along with diet and exercise. Without proper care, type 2 can turn into type 1. Type 1 is the most serious and least common form of this disease. This is when your body is unable to produce insulin. And since your body can't make insulin, you have to get it from somewhere. And in that case, you have to take insulin via injection, or you can use an insulin pump. And then, of course, you also need diet and exercise to maintain healthy blood sugar levels. Type 1 typically occurs in children and young adults and is previously known as juvenile diabetes. Diabetes can also cause complications within other parts of your body, and this is typically high blood pressure, which can lead to heart disease and stroke, blindness, kidney disease, nervous system disease, and amputation. Amputation is usually the result of nervous system disease because if you get a cut on your foot, you can't feel it, and then it gets infected, and then next thing you know, you lose the limb. Diabetes affects people regardless of age or background. I have defined what diabetes is, and I have explained the 3 types. Type 2 may be the most common, but type 1 is the most serious. Since no cure is available, it's crucial that it's managed to help reduce the risk of complications. It's also important to maintain a healthy lifestyle so you don't become at risk for developing this disease. Eating a well-balanced diet, exercising, and seeing your doctor regularly can help you lower your risk. Thank you.
One.